performing nasal instillation. Nasal instillation are used to treat allergies, sinus infections, and nasal congestion. The nose is normally not a sterile cavity, but because of its connection with the sinuses, medical asepsis should be observed carefully when using nasal instillations. Assessment. Assess the nares for redness, erythema, edema, drainage, or tenderness. Assess the patient for allergies. Verify patient name, dose, route, and time of administration. Assess the patient's knowledge of medication and procedure. Assess the patient's ability to cooperate with the procedure. Objectives: to instill directly the medication into the nostril or nares, to provide means for nasal evaluation, to obtain desired therapeutic effect. Equipment: medication, dropper if not part of medication container, gloves, tissue, medication card.
Gather equipment. Check medication order against the original physician's order according to agency policy. This comparison helps to identify errors that may have occurred when orders were transcribed. The physician's order is the legal record of medication orders for each agency. Know the actions, special nursing considerations, and safe dose ranges, purpose of administration, and adverse effect of the medication to be administered. Consider the appropriateness of the medication for this patient. This knowledge aids the nurse in evaluating the therapeutic effect of the medication in relation to the patient's disorder and can also be used to educate the patient about the medication. Perform hand hygiene. Hand hygiene prevents the spread of microorganisms. Place medication on a tray or move the medication cart outside of the patient's room or prepare for administration at the medication area. Organization facilitates error-free administration and saves time. Transport medication to the patient's bedside carefully and keep the medications inside at all times. Careful handling and close observation prevents accidental or deliberate disarrangement of medications. Identify the patient by checking the name, identification of the patient's identification band, or ask the patient to state his or her name. Identifying the patient ensures the right patient receives the medication and help prevent errors. Explain procedure to the patient. This is to gain cooperation and to allay anxiety. Offer tissue to patient and ask patient to blow his or her nose. Blowing the nose clears the nasal mucosa prior to medication administration. If patient is lying down, tilt head back over a pillow. This position allows the solution to flow well back into the nares. Do not tilt head if patient has a cervical spine injury. Draw sufficient solution into dropper for both nares. Do not return excess solution to a stock bottle. Returning solution to a stock bottle increases the risk for contamination of the stock bottle. Ask the patient to breathe through the mouth. Breathing through the mouth helps prevent aspiration of solution. Hold tip of nose up and place dropper just above nares, about 1/3 of an inch. Instill number of drops in one nares and then into the other. Avoid touching nostril with dropper. Touching the nares may cause the patient to sneeze and will contaminate the dropper. Have patient remain in position with head tilted back for a few minutes. Tilting the head back prevents the escape of the medication. Perform hand hygiene. Hand hygiene deters the spread of microorganisms. Assist the patient to a comfortable position. This ensures patient comfort. Evaluate patient response to the procedure and medication. The patient needs to be evaluated for any adverse effect from the medication or procedure.
Evaluation. Patient cooperates with nasal instillation of medication. Desired therapeutic effect is obtained. Experiences no adverse effect including allergy response